Good evening, team, and welcome to the Modern Management of the Older Adult podcast. My name is Dr. Trissa Hutchinson, and I am a TA within the Older Adult Division. Today, I am here to talk to you all about 5 benefits to screening your patient's cognition. First, when we're talking about cognition, I am not just talking about someone's memory. I am talking about all parts of cognition, referring to someone's ability to think, learn, remember, their awareness of their surroundings, using their judgment, attention, language, and perception. We are looking at all parts of cognition. I want to just touch on a few different cognitive screens and how they can help you within practice, just to get you familiar before we deep dive into the 5 benefits of why you should be using some sort of a cognitive screen in your practice. So first, I'd like to talk about the slums. So this is a 1-page screen. There is 11 questions. They ask very simple, basic, yet very informative questions to gather a great understanding of your patient's cognition. This takes about 5 to 10 minutes, and it is very, very much so evidence-based. It is great at capturing if an individual is leaning towards showing signs of dementia or some sort of a mild cognitive impairment. Another one out there that you've probably heard of, it's very, very common, the MoCA. This also is a 1-page, very quick screen, takes 5 to 10 minutes. However, this one does require a 1-hour training session. It is worth CEU credits, but it is 1-hour training session that does cost $150. And then there are also a few others. You might have heard of the BIMS, the mini COG, or maybe the mini mental status exam. All of those are also quick and easy cognitive screens. However, when it comes to looking at what is going to be the most bang for your buck, you're really going to want to focus more towards the slums screen. Super easy assessment and screen to pull up. Literally, you can type into Google slums assessment PDF. It will pop up immediately. It's just a 1-page PDF. There's instructions right there on how to give the screen. Takes, again, 5 to 10 minutes, no further training other than reading the instructions. So highly, highly recommend that you look into grabbing the slums, and I am about to tell you why. So for screening cognition, 5 benefits. The first benefit I want to talk about is establishing a baseline. Understanding your patient's cognition is very important when we're developing and building a comprehensive clinical picture of your individual. We talk a lot about making sure that we're looking at all different domains of physical capacity, but we also need to include a baseline for their mental capacity as well. This will help you when you're ruling in or ruling out any sort of further cognitive impairment and whether or not maybe you need to refer on for a more comprehensive cognitive assessment. This also, having some sort of a baseline established, can help you if maybe you have a frequent flyer and you're working with them now, and then you have that information, you know where their cognition is at currently, and then maybe you see them in a year or so and you're noticing some things are off. This can help with detecting changes in cognition, as well as if you have that baseline and maybe you're working with someone now and even in 2 weeks they come back and they do not seem like something is similar. You have a baseline and you know where they should be at. Maybe you can even use this as some sort of a way to detect for maybe someone might be showing signs of a UTI or an infection or dehydration. But having that baseline cognition can be really, really helpful. Again, in ruling in or ruling out some sort of cognitive impairment, just establishing the baseline. So that's your first benefit. Benefit number 2, knowing someone's cognition can really help with guiding your session into success. So guiding you to success. This is what I'm referring to with this is if you know someone's cognition right off the bat, you have that baseline and now it's a guide. When you understand this and you go up to someone in your session, you will know exactly how to approach them from the get-go. Meaning, you may not need to walk in and say, "Hi, I'm Trissa from occupational therapy." because they will not understand what that means depending on their cognitive level. That may be 100% appropriate and very professional and be received well. However, as I mentioned, for some people, that might not be the approach. Maybe we need to more so approach as, hey, let's go for a walk. And then we're guiding them into our next step of our session. This can also help with guiding successful cues. Am I going to need to use more of a visual cue, a simple cue? Am I going to just have to play a game? So rather than having your patient do squats or box squats or sit to stands, maybe I'm going to engage them in something like shooting Nerf gun darts and then having them bend down and pick up all of the darts off of the ground. And that's going to be how I get them to participate in sort of like squats instead of asking them to do rote exercise, because that may not work depending on someone's cognitive level. All right, establishing the baseline, guiding you to success with your approach initially, as well as your cues throughout your session, and picking interventions that are appropriate. Number 3, knowing someone's cognition can be extremely helpful in determining if your home exercise program will actually work. Knowing if your home exercise program will actually work. I have witnessed individuals who I have screened their cognition and done actual comprehensive full cognitive assessments on individuals. And I had a therapist who was trying to give them a verbal home exercise program of multiple exercises, multiple sets, multiple reps. And I knew that there was no chance that this patient was going to remember what they said even 5 minutes after the session. So being mindful of understanding someone's cognitive level, again, can help with building that home exercise program, whether it needs to be written out for the patient, whether pictures need to be included. Maybe it needs to strictly be caregiver led, and you need to have whoever is their primary caregiver sitting next to you in the session and making sure that they are fully aware and understanding of how to guide your patient through this, and making sure that they're willing as well. Maybe you need to have some sort of a higher frequency because a home exercise program isn't plausible and there isn't a caregiver that is capable of helping that individual at the time. The facility that I work in right now, oftentimes we do have to have some sort of a higher frequency sometimes for individuals in memory care because their home exercise program, it's not plausible. They don't have that one-on-one assistance. And so we need to figure out how we can integrate exercises throughout their daily action. So, all right, establishing a baseline is your benefit number 1, guiding your success or your session into success, and then establishing a home exercise program that is actually going to work for your patient. Number 4, screening cognition and knowing what your patient's cognitive level is can really, really reduce therapist frustration. If you go into a session knowing and fully understanding that there is cognitive impairment on board to some extent, likely you're going to have an understanding that you might need to be extremely creative. The plan that you have in your mind might go completely out the window, but you're willing and you're understanding that that's totally okay. That is totally okay, that we can just let go of the pressure of trying to hit this many reps and this many sets. And we're going to see where the patient is at, and we're going to guide them and get them moving to the best of the ability with whatever we have for that day. Rather than you go in and you get frustrated because Betty's not understanding what you're trying to say, and you don't realize that Betty's cognitive level is actually a lot lower than you anticipated. And now, how am I going to get everybody to do all of the same things at all of the same time and all of that? So, additionally, this can also help when you are trying to document your session and say things again went awry. If you're documenting patient's cognitive level is consistent with X amount of score, this leads to how our session went, et cetera, et cetera. So rather than having, we had to guide and walk throughout the facility and it just doesn't feel right when you're typing it, including that information of using that cognitive level to explain and again, create that comprehensive clinical picture for the reader can really help reduce and validate what you're doing for your patient. We established a baseline. You're guiding your session into success. You're establishing a home exercise program that will work. You're reducing your frustration. And the last benefit that we're talking about tonight in terms of screening your patient's cognition would be having evidence-based and evidence-backed objective communication. Evidence-based, evidence-backed, objective communication. What I mean by this is when I am talking to other providers, other caregivers, other individuals that play a giant role in the picture, I am using objective data when I'm talking about someone's cognition, rather than using my opinion or what I think their cognition is or what I have seen them act like on this day. I can say, look at their score on this screen. I think we need more assistance, or I refer because of this objective data. Again, this takes off the pressure of our opinion and places it back on objective information and data. This will be really helpful, especially when you are sharing other ideas such as recommendations. Maybe you're making changes to someone's living environment or safety, or you're saying that maybe they should have less choices on a few different things for their overall well-being. It can feel kind of challenging when you're making these if they're an opinion-based recommendation versus using the objective data. That can be super, super helpful, again, to support what you're saying. So starting from the beginning, our 5 benefits to screening an individual's cognition: establishing a patient's baseline with their cognitive level in addition to their physical level, guiding your session into success, finding a home exercise program that will actually work, reducing your overall therapist frustration, having evidence-based, evidence-backed, objective communication with other people on the picture. And so in all, what I would hope you take away from today is take a chance, take 5 to 10 minutes, Google the SLUMS PDF, look it up, read the instructions, and integrate this into your daily practice with your patients. Again, it takes about 5 to 10 minutes. There's no additional training required, and this can really help boost overall your ability to care for your patients and help them feel better, faster, and make sure that their recommendations are appropriate. Thank you, team. A few quick updates as far as our modern management of the older adult classes are going. We are just starting to kick off a few new cohorts on the online courses with level 1 and level 2. As always, you can also catch us for our live course on the road. I highly, highly recommend that you check out our live course as well as our online courses. For myself, I will tell you that these changed my practice for the better in all areas possible. If you want to help be the person that is a hope dealer, you want to help your patients get better, faster, and stronger, faster, this is a course for you. Let's go out there and celebrate positive aging. And as always, if you have not already, we encourage you to hop onto your app downloading device, whether that's your Android or your iOS system, and get the ICE Physio app to stay connected with all of the Institute of Clinical Excellence upcoming information and resources. Thanks, team, and hope you guys have a great night. Go out there and screen some cognition.